High stakes as Democratic leaders stand their ground, demanding Republicans tie the extension of Affordable Care Act subsidies to their short-term spending bill or risk a government shutdown. President Trump calls their demands unserious and ridiculous, but Democrats say it's actually crucial.
Because of the Republican refusal to address the Affordable Care Act tax credit issue, at least 20 million Americans are about to experience dramatic increases in their health care premiums, copays, and deductibles.
And joining me now, former Secretary of Health and Human Services under President Obama, Kathleen Sebelius. She was instrumental in getting the Affordable Care Act into law. I welcome you. Thank you so much for being here. I want to get to some stats here because the nonpartisan KFF research group says healthcare costs could increase as much as 75% if these enhanced tax credits are allowed to expire at the end of the year. So who is most at risk if Democrats are unsuccessful and indeed the cost of ACA marketplace coverage goes up?
Well, Alex, the portion of the population in the marketplace are entrepreneurs, folks who run their own small businesses, people who are in the workforce but don't have a large employer paying a share of their healthcare costs. The government helps with tax credits, individuals to buy their own health insurance. We think it's a good idea, at least we did when President Obama was in office and President Biden. I think it's a good idea for everybody to be able to have affordable health insurance, be able to pay their bills, access a doctor, have preventive care. So you have 22 million people now in marketplaces. If these tax credits expire, folks who are in the marketplace will suddenly see their insurance costs skyrocket. And unfortunately, what's going to happen very quickly is young and healthy people will drop out. They won't be able to afford it. And they think, I don't really need health care, which means that in most places you will have, again, what is called a high risk pool. Older and sicker people will stay in the marketplace because they're desperate for insurance coverage. And costs will continue to escalate and people will be sicker and not be able to be productive workers.
And so to that end, House Minority Leader Jeffries calls this a Republican healthcare crisis. Is that an accurate description of what's going on here?
Well, I think it's a very accurate description. This deadline for expiration of the tax credits has been on the books for a while. Democrats have over and over again tried to attach it to budget bills, tried to attach it to, unfortunately, this Congress run by the Republicans has not passed many budget bills, but it has come up as independent legislation. But the Republicans have refused over and over and over again. So people will see their health insurance costs, which are already high, dramatically skyrocket. As KFF says, it could be 50, it could be 75%. Lots of folks are going to look at that bill, which will come up immediately over the holiday season, look at that bill and say, we just won't buy coverage for next year. We're going to take our chances and drop out, which is a very scary position for parents to be in, for workers to be in. Yeah. And only folks who are consider themselves pretty healthy are willing to take that risk.
Yeah, it's a heck of a gamble. So critics will say that the expanded tax credits are actually helping wealthier Americans who don't need assistance, and there are increased cases of fraud. Have the subsidies at all gone too far? Are they in need of any kind of reform?
Well, first of all, I haven't ever seen any evidence of fraud. Let's start there. That's, thrown against the wall with everything that the Republicans want to cancel. It's always fraud or waste or abuse. No evidence to back that up. Secondly, I think if you think about someone who works for Ford Motor Company, everyone, regardless of income level, gets help from the company to purchase their health insurance. That's what we're talking about here. We're not talking about wealthy people. We're talking about people who are buying health insurance on their own for themselves and their families. People are supporting their workers, a few workers in the workplace. And the government, again, is trying to step in the role of a large employer and pay a portion of that cost. So I think to suggest that somehow this is only wealthy people is just people don't understand the income levels of folks who are able to qualify for these subsidies. And again, they're not in a workplace where an employer is picking up the costs, is picking up a large share of the workers and the dependents' income. These are folks who are on their own, entrepreneurs, small business owners, owners of diners, military, young families who have retired who don't qualify yet for TRICARE, all kinds of people who are out there purchasing health insurance on their own. And what we saw with increased subsidies, Alex, is that suddenly lots of younger, healthier people bought insurance, came into the market, which is good for everybody. The overall deal is, though, costs don't go down. So if these folks drop out, they suddenly become uninsured customers for the local hospital. When somebody breaks their arm, they still come in and get care. Their doctors don't get paid. They can't keep their medications, but the health crises don't go away. And that's a very scary place for those individuals and families, but really a scary place for everybody who's buying health insurance.
Yeah, you mentioned the hospitals. That was going to be a question. So let me get to this one, because President Trump is bringing his own approach to keeping health care in the spotlight, dispensing more medical advice yesterday, reiterating his call for pregnant women and young children to stop taking Tylenol for any reason, and offering his own timeline on getting vaccines, which is not backed by scientific evidence. And meanwhile, you have President Obama, who issued a pretty rare rebuke against Donald Trump for linking Tylenol to autism. Let's listen to it.
Making broad claims around certain drugs and autism that have been continuously disproved, that undermines public health, can do harm to women, creates anxiety for parents. All of that is violence against the truth.
Violence against truth. How concerned are you about the administration's health care advice?
Well, I find it horrifying. Pregnant women have been told for decades that Tylenol is one of the only safe and effective drugs to take with your doctor's advice during pregnancy. To tell women, tough it out, is one of the most horrifying statements I've ever heard coming from the Oval Office. It's demeaning to women. It suggests to women who may have a child with autism that they did something wrong by taking Tylenol. It removes the possibility of a safe and effective, not only pain reliever, but a drug that reduces fevers. Nothing can be more dangerous to a mom and a fetus than spiking a high fever. So this is dangerous, it is demeaning, and it is totally not backed by science. And coming out of the Oval Office and the Secretary of Health and the President is really shocking.
Okay. Former HHS Secretary Kathleen Sebelius, thank you so much for your time. Appreciate it.